Hi, I'm Mary Moncton, and this is Module 6, and it is part of Part 2, School Age, ages 3 to 21. The title of this module is Speech and Language Evaluations. This module is the 6th module of 7. What you will walk away knowing today is the difference between a communication evaluation versus a speech and language evaluation, common terminology and acronyms, best practices for comprehensive evaluation, what tools are typically used and why they are used, and eligibility criteria for speech and language services in Texas. This is a side-by-side look of the difference between a communication evaluation and a speech and language evaluation. I'm going to come back to this slide after going to the next slide in order to review some specific terminology that is important when thinking about the differences between a communication evaluation and a speech and language evaluation. An FIE is a full and individualized evaluation. A speech and language evaluation may be included as part of an FIE. However, a communication evaluation may also be included. And again, I'll go back to the slide before this in order to go into more depth about that. Here in Texas, the terms Part A, Part B, and Part C were terms that were referred to criteria that helped determine if a child was a child who had an auditory impairment, or AI, here in Texas. Part A refers to an otological assessment, that is, a specific assessment done by an ENT doctor. Part B was referring to an audiological assessment, which is a hearing assessment conducted by an audiologist. And Part C was referring to a communication evaluation. These terms, Part A, Part B, and C, are no longer used. We just refer to these three criteria, otological, audiological, and communication evaluation, as the three ways that we determine if a child qualifies as a student with an auditory impairment here in Texas. It's important to note that the communication evaluation, formerly known as Part C, can be conducted by an AI teacher or a teacher of students with a hearing loss. Again, like I said, AI refers to an auditory impairment, or a deaf ed teacher. It is not required that a speech-language pathologist be the one to do the communication evaluation for the purpose of qualifying a student as a student with an auditory impairment, or AI. Again, I'll come back to this slide to continue discussing terminology once I make these distinctions here about this communication evaluation being different from speech and language. So as I just said, a communication evaluation is different than a speech and language evaluation, and this is partly because of who is involved. Like I just mentioned, it is not required that a speech pathologist be the one to conduct a communication evaluation for the purpose of determining eligibility as a student with an auditory impairment. Why we do a communication evaluation is part of that three-tiered criteria to see if a child is a student that meets the eligibility for an auditory impairment. And this typically happens when a child is going through a full and individual evaluation to determine special education eligibility. And the result would be to determine if a child is a student with AI, auditory impairment, or not. So again, all of that refers to what we refer to in Texas as a communication evaluation. The speech and language evaluation, however, must be conducted by a speech-language pathologist. It may be part of an FIE, a full and individual evaluation, or it may be requested as a standalone evaluation by someone in the ARD committee. It can be requested by family or another ARD committee member, such as a licensed school psychologist, teachers, something like that. Why we do a speech and language evaluation is to determine if a child is a student who meets the eligibility criteria for SI, which here in Texas refers to speech impairment. And when this happens is, again, usually as a request as part of an FIE or a request made in an ARD by a member of the ARD committee, which could be, again, parents, family members, teachers, or any other professional involved in a student's special ed services. And the result of this evaluation, a speech and language evaluation, would be, again, to determine a child's eligibility for speech services in the school system. Other terminology here in the slide that I have not yet mentioned is normative data and standardization. Again, in Module 2, Cheryl refers to these terminology with a visual of the bell curve to discuss what normative data means and what standardization means. She also shows an example of a receptive vocabulary test that is a good example of showing standardization and normative data. Other terms you may hear, which I mentioned before, is ARD. And ARD refers to admission, review, or dismissal. And here in Texas, that is what we call when the committee comes together and discusses a student's individual education plan, which there is the IEP, and it's the document that discusses what a child's services are. And speech and language evaluations usually occur and are reviewed during an ARD meeting. And if a child is eligible for speech services in the school system, then the speech pathologist would develop IEP goals for that student. Primary communication mode refers to the primary mode that a student uses. So it may be spoken English, it may be sign language, it may be American Sign Language. Informal assessment is any assessment that is not standardized. So examples of such would be checklists, classroom observations, parent interview, or teacher interview. All of those forms of evaluation are considered informal and not standardized. Best practices for a speech-language pathologist includes making sure that we remember that we need to provide culturally and linguistically appropriate services and quality of services to our students. Regardless of our own personal culture, practice setting, or caseload demographics, we need to make sure that we're supporting the student in the best way possible that matches their cultural and linguistic diversity. Various assessment tools may be used. Specific articulation tests, again, may be given to assess a child's specific spoken English sounds, so how they say their words. An example of this is to show a child different pictures. For example, one might be a telephone, and what we're assessing during these specific articulation tests is if a child can say all of the sounds in that word, telephone. We are not assessing whether the child can identify that picture, and we're not assessing if the child is able to use a sign, but articulation specifically refers to spoken language assessment. Single word vocabulary tests are used to assess a child's word knowledge, specifically how a child is able to label pictures, and then receptively if a child is able to identify pictures. So again, when thinking through single word vocabulary tests, these are typically English-based, and expressively, the expectation is to show a child a picture and for them to accurately label it, whether in spoken language or in some form of manual sign. Receptive refers to showing a child multiple pictures, and if the speech-language pathologist signs or says the word, can that child identify it? There are comprehensive language tests that can also be used to assess your child's language. It is important to know that these comprehensive language tests are to be used to assess the child's primary mode of communication. So these tests are used and provided in the child's native language or primary mode. A speech reading assessment can be conducted if the ARD committee or people working with the child deem it important to assess a child's ability to lip read when a person is using spoken English. Speech reading tests are usually not standardized, but is a good way to gain information about how a child is making connections between spoken English and then specifically relate it to written English for academic purposes. Another possible assessment tool that may be used is something to assess pragmatics or social language skills. An example of this may be a checklist that teachers fill out or a classroom observation in which you get data that assesses a child's overall interaction with his peers in the classroom. This is a flowchart that gives a really good visual about SI eligibility here in Texas. And there will be a handout that you can download in order to see this full size, but I thought it was really important to note it here because it specifically discusses speech impairment and how a child meets eligibility for this here in Texas. More specifically, here in Texas, it is a 3-tiered eligibility process. The first thing to determine through a speech and language evaluation is there a disability condition present? For example, a communication disorder. The second part of eligibility criteria is that you need to assess, is there an adverse effect on the child's educational performance? The third tier for determining eligibility here in Texas, again, in the school system, is that if there is an adverse effect on educational performance due to a disability, is that adverse effect, does it require the specific expertise of a speech-language pathologist in order to help that student access their curriculum? And this is very important to remember because dependent on your school programming or your child's progress, academic progress, overall program, what it looks like, although they may have some sort of disability or communication disorder or speech delay, we need to also determine if there's an adverse effect and if it requires the specially designed instruction from a speech-language pathologist.